All right, so the study that I chose is looking at dietary interventions in patients with non-alcoholic fatty liver disease, and this is being presented by myself, Brianna Reed. And so, right now, non-alcoholic fatty liver disease is the most common cause of chronic liver disease worldwide. 25% of the global population and 90% of obese population have some degree of non-alcoholic fatty liver disease, and about 3 to 5% of those populations have active stage non-alcoholic steatohepatitis. And individuals with type 2 diabetes and metabolic syndrome are both at an increased risk of death from non-alcoholic fatty liver disease. 60% of individuals with type 2 diabetes and 50% of individuals affected by dyslipidemia are affected by non-alcoholic fatty liver disease. And so the main interventions for this condition have primarily looked at lifestyle changes through diet and physical activity. And the international recommendations are really just focusing on weight loss through either a combination of dietary changes and physical activity or just one or the other. And the reason for this is that a reduction in weight of about 5 to 7% can actually reduce hepatic steatosis. I have a hard time saying that word. And then about 10% of weight loss can improve fibrosis and inflammation of the liver. And so the purpose of the study, some background, there's really no consensus on a macronutrient composition for this condition, like should it be low carb, low fat, high in unsaturated fats, things like that. Most of the leading organizations, they recommend the Mediterranean diet for the condition. And the studies that exist right now have looked at just pretty much a combination of diet and physical activity, not just one or the other, for looking at this condition and improving the condition. And so currently right now we just have very limited evidence to show that one dietary approach is more beneficial than another one. And absolutely no studies right now are looking at diet and the effects of liver inflammation and on fibrosis of the liver. And so real purpose is to review randomized controlled trials with dietary interventions and not looking at physical activity at all. Outcomes that they're really looking for is a reduction in intrahepatic lipid content, hoping to find something about liver fibrosis, but then overall liver function. So looking at like AST and ALT. And then some secondary outcomes, they're kind of looking at glucose parameters and some lipid parameters like cholesterol. And so the methods that they use the PRISMA guidelines. They did register this, so it's a systematic review and a meta-analysis. They registered it in the Prospero database. And the search databases that they looked for or searched in is PubMed, Scopus, and Cochrane. And then to be included in this review, it had to be a randomized controlled trial. They're looking at just isocaloric or hypocaloric diet interventions without exercise. That's a big piece. And then obviously no changes in alcoholic consumption in individuals with non-alcoholic fatty liver disease. The intervention period had to be a minimum of 4 weeks, and they're looking at adults older than 18 years old with a diagnosis of non-alcoholic fatty liver disease. And through the meta-analysis, the data that they extracted was looking at intrahepatic lipid content, kind of searching for what the research says on fibrosis, liver function, some glucose markers, and lipid markers. And so the results came back that like only 8 studies met their search criteria. Only 5 of the 8 studies were used in the meta-analysis. And of the 5 that they did the meta-analysis on, 499 participants with the age about 38 to 55, both male and female. Studies ranges anywhere from 6 to 24 weeks. 4 of the studies were hypocaloric dietary interventions, and then the other 4 were isocaloric dietary interventions. And of the meta-analysis of the 5, 2 were hypocaloric, 3 were isocaloric. The two hypocaloric were really focusing at increasing unsaturated fatty acids. One through Mediterranean style diet, so increase in olive oil, and then the other one was just increasing in general just unsaturated fatty acids, not specifically through olive oil. It's kind of more of like the DASH intervention on that one. And then they were looking at the other isocaloric diets were kind of looking at like Mediterranean versus like low fat interventions. And so what they found was that in the hypocaloric diet specifically, well, all the hypocaloric diets, the two of them that they did the meta-analysis on, they had a significant reduction in the intrahepatic lipid content, ALT and AST, but the Mediterranean diet really showed a reduction of liver fat by 56%, so it was pretty significant. In either diet, there's no changes in any glucose parameters like HOMA-IR, fasting glucose, and insulin, which I thought was really interesting. And there were no changes in the lipid parameters, so no changes in LDL, HDL, and triglycerides. And so the outcomes for the isocaloric dietary interventions they were looking at, they didn't have any impact on intrahepatic lipid content, like no significant impact. They did have improved HOMA-IR and triglycerides, but it wasn't like a huge clinical significance. And there was absolutely no changes in the glucose parameters. And out of all of like the meta-analysis data, they stated that was a 95% confidence interval. So the strength of the study, so the criteria that they used to include in their research, that was ideal because they were solely focusing on non-alcoholic fatty liver disease, those individuals. And then the studies they were looking at too only included dietary interventions, not looking at the exercise portion of it, so we can kind of get a better idea of, okay, how does these diets impact this condition? And then as far as I know, like the study like this had never been done before, just looking at dietary interventions. And then the quality assessment tool that they used, they stated is beneficial for dietary interventions, which allowed them to have a valid assessment and good quality studies. Weaknesses, obviously, there's not very many of them, total of 8, only 5 included in the meta-analysis. But also most of the studies that they were able to use, they were conducted in Iran, so that gives or could cause some bias. And for that reason, no publication bias detection analysis was done. And then also there was missing genetic predispositions in the participants that these studies were conducted on. And so the authors conclude that overall the Mediterranean and hypocaloric interventions improve intrahepatic lipid content, which is what they were looking for. Those diets also reduced, ALT and AST. And also within the DASH diet, and also not even just looking at the ones in the meta-analysis, the DASH diet, that one, but then also the other two in the hypocaloric, there was some weight loss too. So improved AST, ALT, and then also there was some weight loss. Obviously the diet effects alone right now have not been studied enough. I don't think we can really make say one is better than the other. I think that I don't think the authors think that the optimal diet for non-alcoholic fatty liver disease still remains unclear because there's not enough research on it. My conclusion is that we do need more research, right? 5 studies is not enough to kind of make a decision on what dietary intervention is the best. Overall, we do know that, Mediterranean diet has showed an improvement in liver function without weight loss and without the use of physical activity in individuals with non-alcoholic fatty liver disease. So I think I would say like the organizations that are recommending the Mediterranean diet are on the right path. And then still fibrosis and, cirrhotic NASH, that hasn't been addressed. We don't have any information on that, so we can't really make a good conclusion on what dietary intervention would be good for that. But thank you for listening to my presentation.